Good evening, everyone. Thank you for joining us today. My name is Basmah, and I'm here with my colleague Hani. Today, we're here to share insights and discuss an important global health issue, tuberculosis or TB, with a specific focus on its impact within the Arabic-speaking communities. So, TB is not just a medical concern, but also a significant public health challenge that affects millions of people worldwide. So, despite being preventable and curable, it continues to be one of the leading causes of death from infectious disease. So, our presentation for today aims to deepen your understanding of the dynamics of TB, including how it spreads and who is most at risk. We will also explore some unique challenges faced by the Arabic-speaking communities in managing TB and discuss some effective strategies to address these challenges. Let's start by gaining a solid understanding of tuberculosis, its causes, and its global impact. So tuberculosis is an infectious disease caused by the bacteria Mycobacterium tuberculosis that primarily affects the lungs, but can also involve other organs and areas in the body, including lymph nodes, bones, the CNS, and extrapulmonary TB complications include back pain, neurological issues, and fertility. And according to the World Health Organization, they reported about 8.2 million new cases of TB in 2023. This illustrates not only the disease but widespread prevalence, but also its status as one of the top causes of death from infectious disease worldwide. So here are some important things that we need to consider and to be aware of about TB. So TB is not a disease of the past. It still remains as one of the it still remains as a major health issue in the United States and in the globe. Too many people in the United States are still suffering from TB, and approximately 10.6 million cases were reported in 2022, and as I mentioned earlier, is about 8.2 million were reported in 2023. So TB is a serious disease that can cause a person to become very sick if not treated with medicine, and treatments are available to prevent it and cure TB. Here's a nice graph illustrating the number of TB cases for each year from 1982 to 2022, which is the most recent available data. If we look at the graph, in 1992, the US had the highest number of reported TB cases during this period. And as we move on in the graph, we see like a decreased trend of TB cases. And in 2022, we see an example of the lowest number of US TB cases. And let's discuss how tuberculosis is transmitted, which is important for understanding how the disease spreads and what measures can be taken to prevent it. TB is an airborne disease, meaning that it spreads through the air, not the physical contact or using personal tools. This happens when a person, for example, who has active TB, coughs, sneezes, speaks, and those actions release tiny droplets that contain bacteria into the air where they can be inhaled by other person and the other person can get infected. And later on in this presentation, Hani will explain the differences between latent TB and active TB. So anyone can get tuberculosis, but there are some people are at higher risk for the infection. This includes those in close contact with someone who has infectious TB, individuals from or traveling to countries with the high TB rates, including, for example, Philippines, Mexico, India, and so on. And also those people in settings where TB transmission is more likely, such as healthcare facilities, homeless shelters, jails, and nursing homes. So moving on, Hani will continue with this presentation and walk you through our research project in depth.
Yeah, thank you, Basma. So now we'll be talking about, can you move to the next slide? We'll be talking about the research we conducted with the Iraqi Arab Health Board. And the main aim was to improve understanding of TB within Arab-speaking communities. We focus on three main areas: how much people know about TB, what stops them from getting effective treatment, and if the healthcare services available are suitable for their cultural and language needs. We gather data through surveys and detailed interviews, ensuring a rich mix of quantitative and qualitative insights. And our participants, mainly aged between 18 to 34 and highly educated, and provided diverse perspectives on TB, helping us understand various challenges in health education and access. So here is a distribution of age groups and distribution of areas by zip code of the participants in the research. And next slide. And so we'll be talking now about community perception of TB. So we will delve into the perception of tuberculosis within Arab-speaking communities as revealed by our study. Understanding these perceptions is crucial for addressing the disease effectively within these groups. And so the key findings were fear and stigma. Many community members associate TB with significant stigma, which leads to fear and avoidance behaviors. This fear often stems from misconceptions about how TB is transmitted and its implications. Also, there is mixed understanding. Our research indicates a varied level of understanding about TB. While some individuals are well informed about the symptoms and treatment of TB, others have limited knowledge, which can hinder effective prevention and care. Also, there is impact on of education. Those who had received education about TB generally showed more supportive attitude and were less likely to engage in stigmatizing behavior. This highlights the positive impact that accurate information and education can have on community responses to TB. Okay. Now, we also noticed there is some barriers to accessing resources, such as lack of awareness. Many respondents were uncertain about available healthcare resources for TB care. Others disconnect with services, there is a gap exists between healthcare services and the specific needs of the community. Also, limited outreach and education, insufficient outreach efforts hinder awareness and access to care. Other sides language barriers, a lack of Arabic-speaking healthcare professionals makes communication challenging. Also, cultural insensitivity, the absence of cultural sensitive materials, reduce the effectiveness of healthcare communication, and communication gaps. Strategies to enhance engagement and communication in healthcare settings are often lacking. Next slide. So we explored some ways to eliminate TB, and one of these, increasing awareness, conduct community education programs to dispel myths about TB, provide accessible resources, ensuring testing faculties and information are readily available and in Arabic language, fostering support to groups, create community networks for these affected, and train healthcare providers by equipping them with skills to communicate effectively and compassionately. Okay, next slide. Okay, healthcare providers and communities need to think TB. So, okay, just a second. The key to diagnosing TB is for clinicians to think TB when they see a patient with signs and symptoms of TB disease. Because TB is not as common as it was years ago in the US. Many clinicians do not consider the possibility of TB when evaluating patients who have symptoms of TB. When this happens, the diagnosis of TB may be delayed or even overlooked, and the patients will remain ill and possibly infectious. Okay, next slide. There is a difference between latent and active TB, and we feel it's important to aim or focus on these differences. Latent TB remains in the lungs, it's inactive Mycobacteria, no symptoms and not contagious, while active TB often stays in the lungs but can spread to other parts like lymph nodes, bones, kidneys. Active Mycobacteria show symptoms and contagious. Also, there is risk of developing active TB from latent TB if it's untreated. Okay, diagnosis methods of latent and active TB. Latent TB diagnosis usually through skin tests or like interferon gamma release assays. Active TB like through X-rays. Also, there's like blood test can help in diagnosing this disease. And treatment. TB is a curable disease with available treatment. Latent TB usually remain 3 to 9 months treatment depending on the regimen. Active TB generally 6 to 9 months depending on the specific treatment plan and patient response. And yeah, we reached the conclusion. We thought like these are the most important points. TB is major global health concern, the difference between latent and active TB, and the importance of awareness and education. Okay, next slide. And here's like a list of community resources for TB support in Washington State. We can send it to the participants, and if anyone can reach us and send it through email. Next slide. And yeah, thank you all for your attention and participation today. The fight against TB is a collective effort, and each of us has a role to play. We encourage you to carry forward the knowledge and strategies discussed here and become active participants in TB prevention and care within your communities. Should you have any questions or need further information, please feel free to reach out or engage with us after this session. Thank you.
All right, thank you, Basmah and Hani. That's a wonderful slides and wonderful explanation about TB. Now we are at the questions and answers. Does anyone of the participants have any questions for Basmah and Hani regarding this presentation?
Thank you, Basmah and Hani. This was very thorough and wonderful. I really like the visuals you added to the slides. I added some questions in the chat. I was wondering, how did you decide which knowledge aspects about TB to address during this presentation?
Yeah, so the information we choose to decide is based on the research that we did and the answers of the participants in the research. Most of them some of them lack knowledge about, for example, the difference between latent TB and active TB, so we address these. And like the fear and stigma and yeah, some of this information.
Thank you so much, Hani. And also there was this slide about clinicians need to think TB. Was the content recommended by community members? Or how did you decide on that, the content of that slide?
Yeah, so the content of this slide is like some community members also, like they mentioned that there is less, let's say, less important of TB as it was in the years ago. Like there is no information.
Like no fear of TB.
Yeah. And
Yeah.
they also notice like when they go to, for example, to healthcare or doctors, there is no mention at all of it. Yeah.
So like community members think that TB is not on the radar
Exactly.
of physicians when it comes to people from the Middle East and the Arabic speaking community in particular.
Yeah.
Okay.
Yeah.
That's extremely helpful. And can you do me a favor and go back to the slides with the numbers of TB cases throughout the years from 88 to 2022? Are you able to show that slide?
Yes, to see it, the slide.
Yes, I see it. Thank you. So, yeah, this it's very interesting to see the surge of cases in 1992. I wonder if it was related to the HIV outbreak during that time. So there is a strong association between TB and HIV. I don't really remember which year exactly was the highest number, but during that time, like mid 80s through the mid 90s, there was a great number of cases of HIV and multi-drug resistant TB strains. So maybe we can look that up and just for curiosity, but it's very interesting. And it's very nice how we see the TB cases dropped to the lowest at 2020. I think it's basically because there is better HIV control and also more awareness about TB, and there is also TB treatment, so multiple factors. But yeah, this is a beautiful graph.
This is something interesting to know. Thank you for sharing. I didn't know that.
Absolutely. I mean, this applies to the United States about HIV. I don't know about the data among the Arabic speaking community members about HIV and tuberculosis, but maybe something for the future we could explore as well.
Right.
Yeah.
And also there is like increase of TB cases, like especially during the COVID time, but it's still like remain like less than the let's say 2017 and the previous years.
Absolutely, yes. Yeah, absolutely. Okay. I don't think I have more questions, but this was very great. Thank you so much. Thank you both.
Well, all right. I think we have reached at the end of our presentation. Thank you, Basma and Hani, and the participants in this presentation. We appreciate you attending this and looking forward to see you in the next one. Thank you.